If you get sick and if you get septic, your chance of dying is significant and can be as high as 1 in 3. Nationally, it's a really big deal. We have at least 30,000 patients admitted with sepsis. If you look at the number of people that are affected by sepsis, it's twice as many as those patients that are affected by stroke and heart attack.
And it's been a challenge to initiate or to integrate sepsis protocols, not because it's not important, but because there's a general lack of awareness.
Anybody who takes care of enough patients will experience sepsis firsthand, and when not treated well and aggressively, the outcomes are truly tragic.
And in the beginning, we didn't see very many protocols. They were there, but every physician kind of had their way of doing things.
You know, when a patient with a stroke comes into hospital, everybody drops what they're doing and they attend to the stroke patient. Somebody comes in with a heart attack, we find out about it before they even come to hospital. That doesn't exist for the poor septic patient. Nobody says, hey, I think we have a septic patient out there. And especially if you have some other illnesses, if you have diabetes, if maybe you have cancer, if you're frail, elderly, your chance of dying is significant.
When I was a trainee in emergency medicine, we had a child come into emergency who was critically ill, and we didn't have the guidelines and the protocols in place at the time. And despite hours of attempted care in emergency, the patient did not survive his emergency department visit.
I'd really like to see a healthcare system full of clinicians who have sepsis kind of as an index of suspicion, that recognize the time sensitivity associated with the disease, that recognize sort of the common signs and symptoms, and feel empowered to speak up.
We want to see every emergency department that sees over 10,000 patients a year to have a sepsis protocol in place. We want to see them identifying patients early and treating them according to the BC Sepsis Guidelines.
Without the guidelines, I think that a lot more people would become critically ill or not make it.
We have to have a shift in the way we think about these people. We need to identify them early, we need to resuscitate them early, and we need to get their antibiotics in early.
And if we can get all that together within an hour, we can save lives.
The guidelines are out there now, they're published, they're evidence-based, and they're irrefutable. So this is not experimental anymore. So if you get quite sick with sepsis, we only have to treat 5 people to save 1 life.
These are the people that we care about. These are the people in our community.
Because the reality is that it will affect one of us or someone in our families.
Early intervention and treatment in very simple ways can save lives.
The BC Sepsis Network is there to support them, and we want to see the best care no matter where.